helping them raise the awareness so that we can start to become buddies in our system and not bullies in the system. Joining us, we have Deborah Bartholomew, who is a parent. We have Ron Molino, and we have a principal of this Academy for Special Needs, Megan Lee Waterman. Thank you guys for joining us. So I am going to pass it right over to you guys. Deborah, can you tell us about yourself?
My world in autism, or my journey in autism, started when my son was just around 3 years old. Actually, it started before that, when he would have 2, 3, 4 hour long meltdowns or crying fits, and I didn't quite know what that was about. And I have to say that I never expected autism, never expected that diagnosis. He's 12 now, he'll be 13 in July, and it has been quite a journey. It has been a journey filled with frustration, and it has been a journey filled with a lot of triumphs, a lot of victories.
Deborah, tell us about yourself. Are you a working mom? What do you do?
I am a working mom. I'm a single mom of 2 boys. My youngest son is 9. He'll be 10 soon. I work at the hospital, Port-au-Prince General. I'm a doctor there. And yes, it's not easy. It's not easy to fit in all the things that you have to do as a parent, far less as a parent of a son with special needs, yes.
Thank you very much. I mean, I look forward to, and I know our audience looks forward to hearing, you know, your journey and possibly learning from you. Of course, you know, why recreate the wheel? You've done it. You've done several years already, so I'm sure you can share some advice for us. And we pass it on to our dad, who's repping the dads. We always have a dad represented on CARE, Mr. Molino.
Hi, my name is Ron Molino. I'm the father of 2 girls, 18 and 15. My youngest daughter, 15, she's on the autistic spectrum. My journey has been rough, and it has its ups, downs, like every other child, but she is, I would say, more on the middle of the spectrum. We have a lot of communication issues with her. Right?
Of course, Megan is going to have to explain to
Yes.
the audience what is the spectrum. In doing my research,
Yes.
they call it the autism spectrum disorder.
Yes, it is.
Is it the same thing as autism?
Yes, it is. Yes, it is. So she at 2, you were getting the typical development, and then all of a sudden things start to disappear rather than more things add. So, I mean, at that time, we had no one in Trinidad and Tobago who could actually give a diagnosis for autism. Most people, her pediatrician at the time suspected that it might be autism, but she could not give the diagnosis. So we eventually my wife took her up to Miami, and we got the news then. So ever since then, it has been a uphill battle to work with her to try and get her to a point where she can have a normal life.
Right. And is she in the mainstream system, or does she?
No. Because of her communication issues, she's not in the mainstream system. Right now, because of her age as well, she's not really in any particular school. She actually goes to 2 different schools right now, doing different therapies. So she does music therapy, she does dance therapy, she does cooking, she does occupational therapy, speech therapy, and she also goes to a life skills therapy coach as well.
Okay, so I'm sure you have quite a bit of knowledge to share as well. Megan, what prompted you to get into this field? First, tell the audience about you.
Hi, audience. Marsha, it was a completely different change in direction. I have a bachelor's degree in graphic design. I worked in advertising for a couple of years. And when I graduated from my undergrad and returned to Trinidad, I just didn't think that I wanted to settle just yet. You know, I thought I want to do a little traveling. So I actually I moved to South America for a few months, and I started doing volunteer work with special needs kids. and I just fell in love with it. I worked at a school for kids with autism and Down syndrome. I worked with street kids and orphans and just children with different learning difficulties. And then I returned to Trinidad, said, "Hi, Mum and Dad, thanks so much for the degree, but guess what? I'm going into teaching." So I then started at Life Centre, which is a school in Pitti Valley. Brilliant school, wonderful staff, and I worked there for roughly about a year and a half, and then I thought I really want to get proper qualification. So I started exploring my options. Unfortunately, at the time, the degree options in Trinidad and Tobago were limited, so I went to the UK, back to the UK, and I did my master's in special ed with a focus on autism. So that's kind of the journey of how I got into it.
Right.
And then I returned to Trinidad, got this wonderful opportunity to take over a one-year school, which I did. We rebranded and sort of got everything put into place, and that's where I am now.
So you are the principal of the Academy for Special
Yes.
Needs. Is it that you deal specifically with autism?
Predominantly, we have a lot of kids with autism, but we do have a couple with Down syndrome, a few comorbidities. Some of the kids have autism and Down syndrome, apraxia, ADHD, so different learning challenges.
Okay. I glimpsed on the internet the spectrum and what the spectrum looks like, and I am certain that I saw ADHD there somewhere.
Well, the diagnostic criteria changed
Okay.
in May 2015. The DSM-5, which is Diagnostic Statistical Manual, coming out to the States, put together a lot of different names under the autism umbrella. So before that, prior to that, there was autism spectrum disorder, there was Asperger's, there was PDD or PDD-NOS, so pervasive development disorder or pervasive development disorder not otherwise specified. So they sort of culminated everything and put everything together under one umbrella term.
Okay.
Yeah.
And so that's how it is now. It is now on a spectrum with several things. You guys as the parents, I mean, you both spoke about, 2 years old, 3 years old, having things happen, and you kind of go, what is this about? I mean, for me, that's pretty scary because I'm a homeschooling mom, and I took my daughter out of the traditional system because I just felt as if she wasn't necessarily catching the reading. But for someone who's extremely intelligent, she knew everything else, but the reading was giving her trouble. So how do we know? What advice would you give to a parent? Because some people say, oh gosh, well, they're just moving at their own pace, or, well, you're going through a divorce, and so that might be why they're throwing tantrums, or they're lacking sleep. How do you know that it's not a case of, well, I ain't doing my job as a disciplinarian, and it really is that it's something?
Basically, what as a parent you know, right? A lot of times because of the situation, you try to avoid it, or try and ignore it, or just hope it would go away in time. But as a parent, when you look at your child, you see certain things happening, and then you see it not happening, and in your heart of hearts, you know something is wrong. You need to follow your heart of hearts. If you realize something might be wrong here, despite everything that's going on,
Right.
something's wrong, go and have it checked out. Go and start asking questions.
Can we
Ask for
have it
help.
checked out in Trinidad now? Because
Yes.
initially you said that
Yes.
you had to go to
Yes.
Miami.
Yes.
Okay, and where can you have it checked out? Can the average Joe who barely struggling to afford?
That is a difficulty. That is still the difficulty. It is a huge mismatch between the public, what is affordable on the public or available on the public service, and what is available privately. I myself went privately and was able to see Dr. Natalie Dick, who is a developmental pediatrician, the only developmental pediatrician, but think of the only developmental pediatrician for the entire island. And
Where is she located? What, northwest?
well, she's all over except the west. She is attached to Mount Hope, Eric Williams, but she is from South, so she works out of San Fernando, which is where I actually saw her. I saw her in San Fernando and in St. Augustine. And it's really, really difficult. And you're talking about in your initial assessment runs in just under $1,000. If you want a full assessment, you're talking about just under $5,000 or around $5,000.
This is just the assessment.
This is the assessment that you need if your child has to get into school anywhere in the world. You need this assessment. It's called a psychoed evaluation, and you need that assessment. And it only survives 3 years. so anything that you have to get, you have to have an up-to-date one. And it is tough for the average Joe.
So what is being put in place? I mean, we have UNK. We want to do our part to spread the awareness, to help. I know funding with anything is a challenge. You know, I think I've done enough social work to understand that funding, apart from awareness, you know, but what is being done? What needs to be done, you know?
Well, the good news is, as Deborah correctly said, Dr. Dick is a brilliant pediatrician. There's also Dr. Bahadur Singh, who's based in
But they're
South.
in the private system.
Well, Dr. Bahadur Singh is in the public sector, so he works out of the Southwest Regional Health Authority.
And so there is a facility for someone to
Yes.
go and get a free.
Now, the issue being is that the waiting list is they've cut down to about 18 months.
Okay.
And of course, early intervention is always something that is key to a child's development. That being said, I mean, there are options, there are a couple more private options, but as Deborah rightly said, you know,
Is
it
this
is
covered by
costly.
insurance? So if you work in a company and you have group health and no, right. Oh, is that something that we should be looking at to see
Yes, this is something that
who's charging the cost for this?
my husband, ex-husband, used to work with an oil and gas company, and they would actually pay for massages for me because I had a back injury, but they wouldn't cover the cost of therapy for my child. And you know, this is, I think it's partly because there is a catch-up between, this is something that, yes, we've known about, but we're now catching up on learning that we seem to think that it's not so prevalent, and that it's not going to affect any of us really. So if we kind of keep them out into the special needs schools, it won't be catching.
Right.
So we don't really have to deal with it as such, but I think we're missing the ball, we're dropping the ball. We're not realizing that it is going to.
You said prevalent, and your son is not on the extreme ends of the spectrum. So at a glance, he can appear as a child without autism, a child that is capable of going through the system very normally. Tell me, in your opinion, is that why we think it's not prevalent? Because we just have these children camouflaging in the system, and well, we have we have misbehaved kids, we have kids who aren't necessarily literate. Some people say, well, our system is hard anyway, and so they're just struggling like every other child. Would you suggest that if we were to really go through the school system and start to diagnose one by one,
Yes.
the numbers will climb drastically?
They will. I actually spoke with the principal of my son's school and the entire staff, and he actually said, you know, thinking back through my teaching years, how many kids might have been on the spectrum. Just listening to you talk, I can't even diagnose, but just listening to you talk. Long ago, these were kids who would be institutionalized, and we see now that they're not that different to the rest of us. And as I tell my son all the time, I said, kids with autism, people with autism are the ones who have made the world go round. Brilliant minds, Isaac Newton, Bill Gates, they are people who are on the spectrum or were on the spectrum, but we seem to think that they have to look a certain way or behave a certain way, and that makes it a little bit more difficult. Definitely does make it more challenging.
Because, correct me if I'm wrong, with your son, we can't tell just by looking at him?
No.
There are no outbreaks, so there are no.
He does have his stimming moments. So you will see the hand flap, or you may see him.
What is a hand flap?
So you will see the hands.
My hands move all the time.
Behavior. It's, you know, a way of calming down somebody. And I mean, typical people do it. Some people sit and they bounce their leg up and down, and that's a form of stimming and comfort. But of course, that's a little more socially accepted versus, you know, somebody doing that all the time. And I mean, one of the core deficiencies of autism is that social awareness of, you know, it's not socially appropriate to be doing that. Whereas your eye, you know, we could realize that we're sort of hitting the table whilst talking, and that it's not appropriate. You know, I'm speaking with other people, let me quiet it down. But for a child with autism, that may be comforting to them, and that's keeping them in their zone right now, and they're not really even aware necessarily of how other people are affected by their movements at that point in time.
Ron, you look like you want to chime in there.
For instance, my daughter, if you come in a room and watch her sitting down watching TV, you would think she's a typical teenager. It is only when you start to interact with her, or then you realize, okay, she's different, right? So that is one of the issues autism has, right? A lot of data disorders and disabilities are visual, so people pick up and realize that they're visual. With autism, this typical child, you walk on the street and they start to do something different, and people go like, all right, what's wrong with that child? You know, so there is that lack of understanding in terms of
What can we say to Trinidad and Tobago? What can they look out for? How can I mean, we're viewed regionally as well. You know, what can we're going to go on a break, but I'm going to ask the question so that you have time to think about it, all of you guys. Because for me, I mean, I would hate to think that I'm interacting with someone who is on the spectrum and I am being a bully without even knowing, or I'm being, you know, intolerant without even knowing. You know, so we're going to go to a break now, and when we come back, please stay with us, because I think we all need to become a more compassionate society to understand, you know, how to help these angels feel a part of. Hi, and welcome to CARE. If you're just joining us, today we're discussing autism in celebration of Autism Month. We are joined by Deborah Bartholomew, Ron Molyneux, and Megan Lee Waterman. Deborah and Ron are our parents, and Megan is our authority on the matter. She's completed her dissertation in the UK with a focus on special needs. And before we went to break, I asked a question, because I felt, you know, I mean, I think the only experience I have with autism is a cousin in Canada. And, you know, I'm really concerned, are we being compassionate and are we being tolerant as a society? And we may not be doing it, not because we want to, we're not doing it on purpose, because as you guys suggested, they blend in, you know, some of them can blend in very well. And given what's going on in our society with misbehavior and some people just not getting the traditional way of learning, it can appear like that, you know. So what are some of the things that those like myself without any experience, what can we look for? How, you know, help us.
Well, good questions, Marsha. One thing that I really want to discuss today is inclusion. Inclusion into schools, inclusion into society. As we were sort of pre-discussing, autism isn't something that is necessarily visible. You know, it's not like a child looks different. So, you know, they will blend in, as you correctly said. And what we as a society can really do is become more aware and more tolerant and patient. I mean, it's not difficult to realize that every single person on this earth is different in their own way. You know, some may have difficulties in social situations, some may have difficulties with stubbornness, you know. I mean, all in all, it's all different. And one thing that I think that we as a society, especially in Trinidad and Tobago, that is now waking up and becoming more aware, is that we really need to include differently abled members into our world. You know, I mean, one thing that my kids at school do, and I say my kids because I have 11 kids, is that we will go to the grocery every month, every week. You know, we will go on outings every month, and that's not just for the kids to get that idea of being and operating in a different sort of realm away from school and home, but also for like the wider global society to realize that, hang on, there are people who learn differently. There are people who may take a little extra at the cashier. You know, there are people who need a little more patience, and I think we can all do with patience. You know, I mean, that's not hard to us.
I coach children from age 3 to 7. I have had parents call and I've said to them, I'm not trained to deal with differently abled children. I'm not trained to deal with autistic children. Was that the wrong thing to do? Should I have included them and just coach on a more patient level? You know, what would you suggest?
Sure.
You did the right thing. One thing, when you see a situation and you're not sure and you see a parent around, ask. Don't assume, don't come to a judgment, ask. Right? That is one thing as a parent. I mean, I would gladly explain to somebody what is wrong if you don't know what autism is. I would gladly explain to you what autism is. Right? It makes me feel good that you care enough to ask.
Right.
And not just pass judgment or pass comments. That kind of thing. And if you don't know, if you can't deal with a child with autism, tell me up front. Right.
What are some of the things that we can look out for? How from age 2 to age 15, what are some of the signs?
The problem with autism, it's such a wide spectrum, right? You have things like sensory issues, and sensory issues could vary from any one of the senses. Taste, touch, smell, visual, hearing, right? So it could be, and the hearing and all the senses could be different, right? I mean, I've heard of children that, I mean, sometimes the sound of a ringing bell is sound like you're actually inside the bell and this thing is ringing almost on your ears and the bell could be far away. Right, those kind of things. Visual, some children, certain colors trip them off. Right, like they wake up and they see a color before they see a certain color. It could be a bad day for them. Right, it could be a bad hour. Right, taste is a lot of issues a lot of parents have with children with autism, because especially when it comes with food. Right, and then you may have the color with food. So certain food colors, they're not going to touch once it's that color. Yeah, right. And then you have the texture issue, right? Both taste and feel, right? I mean, some children smell as well. I mean, you have things like clothing. I'm glad my daughter doesn't have that issue, but some children, certain types of material, they feel like sandpaper on them.
The thing with, I try to explain to a lot of people who don't know or don't understand. Think of if you've ever had an episode of dizziness, and think of how you felt really, really out of it. That is what they go through on a daily basis. Anything can throw their senses off. So if they're hypersensitive to sound, as Ron rightly said, just that can just throw them off. And what happens is the meltdown or the stimming behavior is an attempt to right themselves again, just like you would hold on to right yourself. It's an attempt to right themselves again, and that's why things like a ball, sitting on a ball, or walking with a heavy backpack upstairs, or a weighted blanket or weighted vest, those things help to center them and to ground them again and to keep them focused, because it's like their senses are off all the time. And for you just to be dizzy for 10 minutes, it's really, really confusing and disheartening. But for them, this is their world.
Yeah, just kind of adding on to what Deborah was saying. I mean, the room that we're in, You know, the bright lights, the hum of the air condition, you know, the small sound of music in the distance. You know, we're not, this is not bothering us. We're operating typically. We're having a conversation, we're continuing. But for somebody with autism, that overwhelming sense could just lead to a meltdown. And again, one of the key areas is social communication. So, you know, an inability to communicate your feelings. Think about if you go to a foreign country, for instance, you don't speak the language, nobody's attempting to speak English, and you're trying to figure something out. You're lost, you are hungry, you need to use the bathroom. How are you communicating that without being able to verbalize it? You know, is somebody picking up on the non-verbal cues? So these are just some factors to be aware of, especially when meeting somebody with autism. Just how they can interpret you and what can you, as the typically developed person, do in return to break down the communication barrier. What can you do to meet them, not just for them to meet us in the sort of society that we live in, for instance?
I'm still not really sure in terms of the younger age, you know, as a parent. I know you said that, you know, sometimes it's a gut feeling, but then that's dependent on the parent and how self-aware the parent is, you know. Self-awareness is a hard thing, you know. Not, I mean, there are mothers on the news that still defend their son after they're going into jail because they're just so far away from being honest with themselves and being able to do that introspection. Is there advice, you know, if you were as Deborah, I'm sure you've had situations where you or Ron, where you see behavior at 2 and 3 years old and you guys could say, this kid needs to get checked out, you know. So what would that look like? What would it look like if you're at a play date and you're seeing something, and because I know, I mean, I test in something called self-smart. I do a lot of introspection, but the average human being is the hardest thing for someone to do.
Yes.
You know, to look at my child and say maybe they're autistic.
Yeah.
Some people can't even admit that they have any kind of learning disability. They're not reading fast enough, you know.
Yeah.
What would you suggest? Some very basic things that a parent out there looking on can look for to say, maybe we should go get tested.
Well, I know Megan is going to add on to this, but from a communication point of view, so one of the things that happens, and I think Ron touched on this, was that their vocabulary, they actually lose words. So they either stop speaking altogether. I know Rowan went down to like about 4 or 5 words. And the stimming behavior and the lining up of things. So you would find that a child with autism would probably line these cups up in a particular order, lining up toys in a particular order. Those are the kinds of behaviors that you would see.
Yeah, excellent examples. I mean, what I would say is your child hitting typical milestones? You know, are they walking at a certain age? Are they talking? Is there that joint attention? That's one of the first things you look for with a baby. You know, if you're interacting with a baby and they are looking at what you're doing and you point at something, do they follow your gaze to look at, see where you're pointed? Or is it that's just completely blank because they're not exactly clued into what you're saying? Is it sensory issues, just as Ron had mentioned, you know, are they fussy eaters? Do they walk on their toes? You know, do loud noises scare them? Now, keep in mind, as I said, it is a spectrum. It's not for all kids. If your child has one of these sort of developmental differences, it does not mean they're on the spectrum. I would always recommend go to a developmental pediatrician. We have a couple of speech and language therapists who are trained in ADOS and can test as well. So I would say get more than one opinion if you're unsure. But some of these are what we'd call red flags for young kids. Sort of by 18 months to 2 years would be when you start really seeing a lot of differences in development.
So we're going to go on a break, and then when we come back, we're going to have our sex ed capsule that's been getting some good responses. And based on the sex ed capsule, we're going to talk about sex education and autism, because it's hard enough to deal with sex education and the average child, let alone dealing with sex education and an autistic child. So stay tuned, don't go anywhere, we're going to be right back.
Welcome back to Care. If you're just joining us, today we're discussing autism. Before we get back into the discussion, we're going to look at our sex ed capsule, and then we're going to talk about sex education and autism. So let's get our sex ed capsule.
Mommy, can you tell me more about how to keep my body safe?
Absolutely. What about I tell you about the alerts?
Yes, please.
Alright, so the first alert is called a see alert. If someone asks you to see your private part, or if they ask you for you to see their private part, or even if they ask you to just see pictures of private parts, that's called a see alert. If someone asks you to touch private parts, that's called a touch alert. And if someone asks to talk about private parts, that's called a talk alert. No one's allowed but your mom and your dad to see, touch, or talk about your private parts. And your mom and dad are only allowed to do it when they're washing you. Or maybe if you get hurt, if you fall and get injured, then they can examine it.
But sometimes Grandma bathes me.
Well, that's very true. So what we should do is create a list of caregivers, and those are the people that are allowed to bathe you, or if you're in their care and you fall and hurt yourself, then they're allowed to examine you. If we have to take you to the doctor, make sure your caregivers go inside with you so that they can help keep that body safe.
Okay, Mama.
Can I have a kiss?
Now, when we were developing this sex education capsule, it was a passion of mine that I thought child abuse and sexual awareness is just something that's not happening. You know, it's Child Abuse Awareness Month, and we've heard nothing about it because it's a conversation that so many of us are afraid to have. We feel that we're not, ready to have it, we're not equipped to have it. And sometimes we can do more damage if we're not having the conversation properly. And I know, when we were talking prior to going on air and we spoke about the sex education, that was like, oh my gosh, such an eye-opener for me that we with children who are non-autistic already have it so difficult. Imagine having, you have a 15-year-old daughter. I'm certain we're at that stage where we're in conversation. So tell us about sex education and autism now.
Well, in my case, it's even more scary because she is non-verbal, right? So a lot of things.
What does non-verbal mean?
Basically, she doesn't really communicate the way we do, all right? So you won't get, mommy, so and so happened today. You're not going to get that.
Can she understand you speaking to her normally, or do you have to break down as well?
You'll have to break it down, right? A lot of the concepts she doesn't understand, or she won't understand in the way you intend, right? So you have to be very careful in terms of the words that you use, because if you say, like for example, top, right? She may think of a toy spinning rather than on top of something. So you have to break things down. So you have to get to sex education in terms of that part of it, right? In terms of further understand the concept of good touch and bad touch, is a work in progress still, because she's still trying to figure out herself in terms of how she communicates with the world and how the world interact with her. Right? So there's still that going on. Right? So we have a long way to go still. For instance, a simple thing like that time of the month is always a mystery for her, right? Because she has a lot of issues like okay, this is happening, and you see a lot of concern every time she goes to the bathroom. There's concern in terms of, okay, where's this coming from, so she's starting to get accustomed to it, but she still have a ways to go with that as well.
In terms of that physical desire, normal human beings, you get to a certain age, you start to have physical desires. Is it that they have the physical desires?
Yes, they do. They do. But the sex education, because, as you rightly said, child sex abuse is so such a taboo issue. But it's in your face. It's there.
Rampant.
It's rampant.
It's 1 in 5, and then they tell you must multiply it because that's 1 in 5 reported.
So I actually started both my boys from early. Rowan, my older son, he wanted to go to the bathroom. I always remember wanted to go to the bathroom on his own. And that was, for me, very, very scary. I was one of those parents. I actually talked to another parent the other day, and she was telling me she was a crazy parent. She would march into that male bathroom, screaming her son's name when he didn't come out after a few minutes. I couldn't deal with that anymore. So I actually I came up with a little thing where I told them, how far down clothes should be if they go to the bathroom and things like that, what parts of the bathroom not to use, so the urinal and that kind of thing. But then I started taking them to the bathroom with me. And last year, one of the cleaners in a mall actually stopped me and told me that he doesn't belong here. And this is where the
Of course, he's older, so
physically he doesn't. It appears that nothing is wrong with him. But how do I? And a lot more parents are actually having this challenge. How do I say? Because there are male parents who also have similar issues with their daughters. How do I send my child to the bathroom and feel comfortable, feel safe? And it doesn't necessarily mean just autism, but you see where it's more difficult. Anyhow you take it, whether they're non-verbal or not, they still have issues communicating how they feel. They have issues communicating. Someone touched me. They even have issues communicating.
Non-autistic children have those issues. I can only imagine an autistic child.
So it is a huge issue to have to deal with. They also, because of this lack of social awareness, they also get very comfortable with strangers. And I remember my son sitting on someone's lap, a total stranger, and I did some reading. And there's this thing called concentric circles, where in the first circle it's mommy and daddy and your brother and sister or your siblings, and then outside, so you can say what you do in that circle. So you can, as you said, you can touch, you can talk about, you can see only within certain parameters, and you can kiss, you can hug. And then outside of that would be uncles, outside of that, and as the circle gets bigger, you see what can happen. So as we move to this circle, they're not allowed to touch, but in this circle they're not allowed to do this. And that's what that actually helped Rowan to understand. Oh, wait a minute, I don't know this person, I can't sit on his lap. I don't know this person, I can't just walk up to him and just throw my arm around and hug him. And it actually helped him be more socially aware.
What did you do to deal with the bathroom issue?
Well, I got really angry at first. I got really, really angry. But he also is at the stage where he doesn't want to use the female bathroom anymore. So I literally sat down and I drew. As Megan can tell you, kids on the autistic spectrum are so visual, and you can. So what we did, he's at the age where graphic novels are appealing to him, and so we sat down and we actually drew our own graphic novel about using the bathroom. And
it's called published.
Yeah, it's called A Social Story, and we've been doing those since he was 2. But because of his age, graphic novels are very appealing, and I'm very much into art. So we sat down and we devised our own story, and it's worked wonders. It's even worked with his brother as well.
Are there books like that, Megan, out there that can help, that parents can purchase? I'm certainly not autistic, so how am I going to create this social story?
Great example, and it was definitely something I wanted to touch on. So social stories, as Deborah correctly said, kids with autism are very visual thinkers. And a social story is pretty much just a set of pictures. You can pair it with words. You don't necessarily have to have words. I mean, even if you think, and I like to use this example a lot, about if you're in a class setting and a teacher is talking and you zone out for 2 minutes, then you need to come back and you need to think of that auditory process and what are they saying. But if they stop and they put it on a blackboard, then you have that visual picture, which will further cement into your brain and sort of support what words are being said. So for somebody with poor receptive communication, not able to fully receive or comprehend at a processing level that typical persons would, then that visual pairing will be a big benefit to them. So even if you're not autistic, once you can do a stick figure and you can draw a box and you can do a stick figure and maybe a larger stick figure, and you have good touch, bad touch, use red for stop, green for go. Right now in terms of books, luckily the entire world is becoming a bit more aware and a bit more sensitive for children who need visual support, and need visual support in taboo topics or somewhat taboo topics like sex ed, development, puberty, that sort of thing. So locally, I can't recommend anybody locally who's done something. Maybe that's in the works. Maybe we could all collaborate. But you can definitely find interactive CDs online, on social stories. There are programs that you can plug into the computer and you can type, and the picture symbols will sort of be paired together. You can then sit with the child and you can say, this picture means this word, so when you see this, this is what it means, and you read it out and you do it as many times as necessary. And it's a great tool to use for any situation. We're going to the grocery today, we're not going to the grocery we usually go to, we're going to a different grocery. This is what it looks like, this is what we do. We get in the car, we put on our seatbelt. So it's a sort of step-by-step breakdown.
Okay, we're gonna get ready to go to a break now, so I'm gonna give Ron a chance to chime in on what have you done specifically with. You have two children.
Yes.
Yes.
In terms of the bathroom, I mean, when she was small, it was easy. It was easier because most times I would probably take them out on Saturdays, that kind of thing, go in the mall and walk around. So it was easier when she was small to take her into the bathroom. But as she get older, it became a little more difficult. But luckily for me, she has an older sister, so now she normally goes with her sister.
Okay.
Right, so it makes life easy. But if her sister wasn't around, I'll have to go in and peep and see if the men's room is empty, and then sneak her in, right? Because most places do have family bathrooms, right? And the reality is, you have fathers that go out with daughters normally. So depending on the age, you as a father, you don't want to send your 6-year-old, all right, go in the bathroom and go. That's
Agreed. So family bathrooms can possibly be one solution.
Yes.
That we should be thinking of.
Yes.
Okay. So we're going to go on a break now. If you're just joining us, we're talking about autism. We're joined by Deborah, Ron, and Megan. Don't go anywhere. We're coming right back. Welcome back to CARE. Today, in celebration of National Autism Month, we are joined by Deborah Bartholomew, Ron Molino, and Megan Lee Waterman, all in the autistic field. Megan and Ron have a child with autism, Deborah and Ron have a child with autism, and Megan is charging the course. She has a school for the special needs. Before we have to leave. I know we can talk about this forever. It's been such an eye-opener for me, so thank you guys for agreeing to come and do the show. But before we go, there are a few questions that I'd like to ask and have answered briefly if possible. Deborah, your child, very different to Ron and to Megan, is in the mainstream system. What would you like to see in our system, to deal with autism?
At every school, someone who's there solely to deal with someone with special needs. So someone who is a support person to who deals with the real issues. Teachers or helps the teachers to make their classroom more inclusive, to make their classes more more available to the child with special needs, is because it's not just kids with autism.
Would you say that it's better to have them included? I mean, I'm guessing in the case of Ruru is not so far along the spectrum. So would you suggest that in a situation like that, yes, once the needs are met, that it would be better to have them in the mainstream?
It is. I think Megan will agree. It's always better to have the child included. Like I said before, these kids used to be institutionalized long ago. It is always better to have them included.
Yes, I do agree. As we've been saying, it is a spectrum. Sometimes it may be too overwhelming for a child, but sometimes it may be just the right sort of support network. And I think that Trinidad and Tobago has a way to go. I mean, we are becoming more aware. I hope you guys would agree. I think, as Deborah said, it would be wonderful if every single school had that special needs support network. But I also think that it, depending on the child's abilities, it's when we need to sort of see if they would function better in a smaller environment and be included for different components, or is it that they are capable of being in a mainstream environment, or is it that the entire idea of a mainstream environment is too much for them. So because it's a spectrum, it's really down to the child, and I think parents and teachers need to have that collaboration. They need to be on the same page. I mean, we need to realize that sometimes the support network is not there from either party. I mean, some parents really want their child to go to a mainstream setting regardless of, you know, whether or not they can answer their name or whether or not they're able to sit for 5 minutes, you know. Is it going to do your child more harm sitting in a class with 30 kids having to raise their hand on cue? Or would they be better off in a smaller mainstream environment with 10 kids, you know, where they get a little more individualized attention? Right. So I think it really comes down to the kind of communication between not just parents and teachers, but also any sort of support network, you know, therapists, grandparents, caregivers. What is the best option for this child? Not what the parents want necessarily, but what is the best support network, and is everybody on the same page? Because you need to be on the same page. You need to be consistent throughout as well.
As you say, Marsha, it's back to a village mentality. You have to go back. The child with special needs must be raised by a community. It's a community of therapists, doctors, parents, grandparents. I mean, my mom is one of Rowan's biggest advocates. You know, you need that. The speech therapists, the occupational therapists, teachers. We actually have meetings on a regular basis. You must have that community approach.
Yeah. One of the issues I have is because my daughter is 15, it's sort of limiting her in terms of where she could probably go and get some sort of education. That's one thing I'd like to see, right? We not put an age limit on education, especially with children with special needs.
Well, it's been a real pleasure and a real eye-opener. Guys, thank you so much. Maybe we can get them to write a piece and we'll put it on the Facebook page, or we can bug them for their telephone numbers. It's been a pleasure. I hope you guys have learned as much as I have learned in the last hour. I wish we have more as always. But see us next week. Next week we talk about child abuse, and let's see how we can help with that topic as well. See you next week, guys. Thank you for joining us on Care.